in.
Hello, my name is Katie. I'm going to be your nurse today. First, I'm just going to close the curtain and provide privacy and just wash my hands. And can you verify your name and date of birth for me?
07/22/89.
I'm just going to check your wristband. And just upon inspection, I see that your head is normally cephalic. Your skin color is appropriate for ethnicity. Your pigmentation is even. And I know you just said your name and date of birth, but do you know why you're here?
I'm here for an assessment.
And do you know what time it is?
It's about 10 something.
Okay. And do you know who the current president is?
Donald Trump.
Perfect. So I would just document the patient is alert and oriented times 4 to person, place, time, and situation. And if you were unconscious, we would use the Glasgow-Coma scale. This is typically used for patients who have suffered brain injury or anything traumatic to the head. And this evaluates your eye response, your verbal response, and your motor response. And is it okay if I touch you?
Sure.
Have you been having any headaches or any itchiness or dry scalp or anything? Okay, so I'm just going to assess the back of her head. I don't see any lice or anything like that. She's clean. She's dressed appropriately for the occasion. And just to get started, I'm just going to look at your ears.
She knows them. Okay. So now,
Have you been having any drainage?
No drainage.
Any ringing in your ears at all?
No.
and I'm going to knock on the door.
And I'm just going to assess your skin. Also, I see that your nails are round, they're clean, I don't see any clubbing. Also, your capillary refill is less than 2 seconds. And I'm just going to check your skin cover. It goes back immediately. Good. Well hydrated. Do you wear contacts or
I don't.
glasses? Have you had any blurred vision?
No, I haven't.
Okay, so your pupils are equal. They're round. They're about 4 millimeters in size. And now we're just going to see if there's respiration accommodations. I'm just going to search each of your eyes and see if they can stretch.
Respiration is vital sign. Okay, so that is low. So I would not
So
get
pupils
that.
are equal round reactive to light and accommodation.
Oh, okay, so that's normal.
And
Okay.
then your nose, I see your nose is
Also,
midline to the body.
I
Also, your
have a
speech is
second
intact, just the
patient
verbal
here.
response. And I don't see you have a deviated septum. Can you just close one nostril forward and close? Do the other one. And also, if you had any difficulty with your hearing, we would do a little hearing test and repeat after me. And can you just swallow for me? So your swallowing is normal. Also, your skin is warm to the touch. Can you just open your mouth? So your oral mucosa is pink. I don't see any missing teeth, any gaps, or anything like that. And also, can you just pull your eyes down for me?
Vitals are good.
So your conjunctiva is pink. Okay, so that's good.
Okay. So for heparin,
And then moving on, can I get you just to sit at the edge of the bed for me? I'm just going to assess your gait. Have you been having any difficulty walking or anything? Okay, so just walk forward for me. And then walk back. And then I'm just going to get you to stand there and just close your eyes for me. This will be the Lombard test. Just, I don't see any swaying or anything. You can have and then I'm just going to assess your 2 upper extremities. I'm going to support your arm at the elbow. Just get you to flex, extend. I'm going to apply some resistance, flex, extend. The same thing. I don't hear any cracking, popping, or anything. Flex, extend, flex.
I'm gonna stand
And then up to your wrist, I support you at the wrist.
make sure
And
everything
then flex,
matches and you are the patient, it's
apply
right,
some pressure, flex, extend.
right patient, right medication, right dosage,
Extend,
right.
pressure, flex, extend. Okay, and then we're going to move on to your lower joint.
Okay, so then.
So
I'm
your
going
strength
to-
is 5 out of 5 bilaterally on your upper extremities. I'm just going to support you at the knee and then flex, extend, flex, extend. Okay, and then the other leg, flex, extend, flex, extend. Okay, and then I'm going to support you at the ankle, and then just flex, extend, flex, extend. Okay, other side, flex, extend, flex, extend. Okay. And you can have a seat back in the bed. Right.
Oh, so I'm actually gonna put it in.
And also, I didn't see any jugular vein distension upon your, just observing your neck and throat, anything. Is it okay if I listen to some lung and heart sounds?
Yes, ma'am.
So first I'm going to start with some lung sound. I'm going to start in the right upper lobe. We would be in direct contact with the skin, but just for video purposes, we're not. So I am in the right upper lobe. Without picking up my stethoscope, we're going to move over to the left upper lobe. Without picking up my stethoscope, we're going to move down to the left lower lobe, the right middle lobe. And I'm going to get you just to cross your hand over your shoulders. Perfect. So we're going to listen to that right lower lobe on the lateral side, and then your left lower lobe on the lateral side. And then I'm just going to listen to some lung sound on the back. I am in the left upper lobe, moving over to the right upper lobe, right lower lobe, left lower lobe.
Oh, okay.
I'm just going to keep listening. Alright, your respirations are 14, so that's good. No adventitious breath sounds noted. This will be described as eupnea. They're non-labored.
But in real life,
Now
I
I'm just
can
going to
do it.
listen to your heart.
Yeah, verify it again, but.
And we're going to start in the second
Okay,
intercostal
so I
space
don't-
on the right
I
side.
think I
This is
said
your
right,
aortic
lower,
area.
quadrant.
Moving over to your second intercostal space on the right side without picking up my stethoscope and in direct contact with
You know, you want me to
skin.
actually
This
do
is
it,
your
right?
colonic. Your third intercostal space on the right, on the left side, this is your urban. Fourth intercostal space, this is your tricuspid. And fifth intercostal space, this is your apical or mitral, this is your point of maximum influence. I will listen here for a full minute. And also S1 and S2 sounds are noted. I don't hear any S3 or S4. I would use the bell of my stethoscope for murmurs.
No.
Okay, I'm just gonna check you for some edema. I'm gonna start from distal to proximal. So I don't feel any edema in your upper extremities. I'm gonna check your lower extremities. Right, I'm just gonna assess your radial pulse. Radial pulse is 2 plus bilaterally, so that's good. Also, your dorsalis pedis pedal pulses and your posterior tibial pedal pulses are 2 plus bilaterally, so that's good. And also some other sites would be your carotid, your brachial,
So what I would do is
your axillary,
I asked you about this.
your femoral, and your
I would
popliteal.
go the top of her
And I'm just gonna get you
and
to
the bottom part
lay the
of
bed
it,
back.
and then I would go in the center.
And have you been having any shortness of breath or chest pain or anything? Okay. And have you been having any difficulty with your bowels or difficulty urinating?
No.
Have you been constipated?
Nope.
Okay. And have you been able to pass gas?
I don't pass gas, but sure.
And when was your last bowel movement?
Yesterday.
Okay. And have you peed today?
I did about an hour ago.
So first I'm just gonna pretend like we're inspecting the skin. So I'm inspecting and I don't see any masses, lesions. I see she has any belly button. Now I'm just gonna take a listen. So I'm gonna start in your right lower quadrant, moving up to your right upper quadrant, your left upper quadrant, and your left lower quadrant. And this is all using the diaphragm of my stethoscope. I use the belt of my stethoscope to listen to a bruit. This is known as a swishing sound, which she doesn't have. And also while I was putting out of the head, I didn't feel any bumps, masses, or lesions.
All right.
Not sure if I
Now,
And
for intramuscular.
I'm just gonna take a look at my rubric.
Have that person speed to 90 degrees. And if they're on the thinner side, you can do 45 degrees.
We are at 10 minutes.
Belt way. Right here. So, I'm going to clean. Okay, when I ask you, you have to say this, go in the center, break it in half. Okay. Alright, so then
Alright, and I'm just gonna palpate. Have you been having any tenderness or anything in any of your areas?
No.
Okay, so I'm just gonna feel around. And also, if you were bed bound, there's two ways I can help you open up some of your airways. One would be the turn, cough, and deep breathe technique. And you would turn over and take a deep breath, and then you cough and just open up some of those secretions. And then also, we're just going to pretend this is an incentive barometer. Do you like to watch TV?
Sure.
Okay, so just we want you to do this 10 times an hour. Just take a deep breath, hold for 2 to 3 seconds. Exhale. And also some risk factors if you were immobile. This would be the Braden risk scale. It would be poor nutrition, immobility, and friction issues, sliding in the bed.
10 seconds, take it down.
Do you have any questions?
I do not. Thank you so much.
Alright, well, I hope you have a good rest of your day.
Thank you.